POTS symptoms were gone before the end of February. I kid you
So it was
not.
4 weeks in the program.
Yeah.
Dana, I'd love for you to introduce yourself, our recent graduate.
Yes, I graduated from the program 3 months ago and definitely have been loving the results. But I am 26, I'm based in New York City, and I've definitely struggled with autoimmune issues for most of my life, but they really hit the fan starting in 2015 when I had a bad case of MRSA
Mhm.
and I went on a ton of antibiotics. I think just really messed up my microbiome and caused just the floodgates to open. So after that, I had a lot of gastrointestinal infections. I contracted Shigella and SIBO. I was on the FODMAP diet for over a year trying to get that cleaned up, which was definitely not the decision I should have been going with. Poor advice on that front. But I, from there, just got severe brain fog. Like my menstrual cycle stopped for over a year.
Yep.
And I used to be a really high achieving student. Luckily, I had finished school at this time, but I just felt like I couldn't say my ABCs. That just felt like my brain escaped from me.
Right.
And I went to a ton of different doctors saying, like, I'm having dizziness spells, headaches. It's hard for me to get up in the morning in particular.
Yep.
And I just got put on antidepressants and anti anxiety meds. And I knew that that wasn't the answer. And I kept pushing, and I finally found this wonderful doctor based in New York who's a neurologist and focuses on autoimmunity as well. And I went in, and he did do a tilt table test and diagnosed me with POTS. And at the
Mhm.
same time, did some nerve conduction tests and a few other things, and diagnosed me with CIDP, which is chronic inflammatory demyelinating polyneuropathy, which
Yep.
means that my immune system is attacking the myelin sheath around my
The
nerves.
nerves. So I want to ask, because Dana's journey is interesting, because I remember the very first day I met you, this is like 4 or 5 months
Yeah.
ago, you said that one of the outcomes that you wanted from the program was you wanted to be a functional human being and to end your POTS.
Yeah.
And my question was, how long did it take from the start of the program to when you first noticed that you
Mhm.
didn't have these POTS symptoms anymore?
So I started the first week of February.
Mhm.
It took me until probably the end of March to realize that my pot symptoms were gone before the end of February. I kid you
So it was
not.
4 weeks in the program.
Yeah.
Okay. And Christina, I mean, you did the program 4.5 years ago. How long did it take you to get better from the pot symptoms for you and dysautonomia?
I think once we got back my blood work, looking at some nutritional deficiencies, and you told me what supplements, what form of the supplements I needed to take, and I started on those supplements, I had improvement within a week.
So that's week 4 also.
It was
And
right about week
so,
4.
and how many years did you deal with those symptoms, Christina, and how many years for you, Dana?
The the dysautonomia symptoms, it was a year that
1
I
year?
went through.
And then Dana,
Mhm.
how
For
long for you?
me, it was at least 10. I was fainting in high school all the
Think
time.
about this,
So,
everybody. These problems that could be a decade long for a 26-year-old within 4 weeks ended.
That's an unheard of. And clearly they had been to so many different doctors, not getting many answers, finally then getting an answer, at least in one case here, but still not getting any help, and then can turn it around in a matter of weeks.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. So let's go into the nitty gritty, because people out there want like the secret sauce. Like, Christina, let's start with you. You said as soon as you got your blood work, we're talking about blood work that's part of our program. We're talking about functional lab values. She got educated on what some of the root causes of these vitamin deficiencies are that are really crucial for anybody with any autoimmune issue. So what was so illuminating about the blood work that was a game changer for your POTS?
Well, for starters, I had always been told that I had really great iron levels, but when you dug into like ferritin and some of the other values, I
Yeah.
realized it was in the toilet. It was
Yeah.
awful. And then I learned that B12 is one of the most finicky vitamins to absorb. And with my digestive issues with the gastroparesis, it was no surprise
Bingo.
that my B12 was terrible, but I'd never been told to take B12. In fact, my rheumatologist actually argued with me when I started on the B12 and the iron, trying to tell me, like, why are you taking this? This is completely unnecessary. Your iron's fantastic. And I said, I feel so much better since I've been on them. I'm going to keep taking them.
Well, here's the thing. Your rheumatologist has zero training in functional values of what's optimal for someone with autoimmune disease. So based on your lab values, I recommend it, and you learned exactly the right supplement and dosing you should take and how to recheck it and manage it for the rest of your life. You had immediate results.
Yeah.
So I'm going to get into what would cause someone with autoimmunity to have really low ferritin and iron. But before we do that, and I'm going to say digestion. But Dana, you had mentioned that digestion was huge for you. Can you explain that part of your aha?
For sure. I mean, just thinking about some of my symptoms beforehand, I'd lost a lot of weight.
Yeah.
And I think part of it was due to I was on the FODMAP diet for over a year, and I just got afraid of food and what to eat. And I think I just also wasn't absorbing things right because, as it turns out, I do lack some digestive enzymes. But
Correct.
I realized once I started the program, I started to take those digestive enzymes with the food that I was eating. So I was able to absorb it well. But I also learned what foods I could eat by doing the food mapping. And that, fear of food kind of went away. So that helped a bit with me being able to get those nutritions from my food, and even not just the supplements.
So this is the double whammy. And I love that we're having this discussion because both you and Christina went on some very restrictive diets for a long time that made you guys sicker. And that could be FODMAP, AIP, whatever it is. Digestion was the key for both of you here in this problem. Let's first step that. And you mentioned taking the correct digestive enzyme, digest it. We're talking about digest it. And that's part of our autoimmune essentials line. Why is it essential? Because guess what? 100% of you out there with autoimmunity have terrible digestion genetically. Did you guys know that anybody with any autoimmune diagnosis, you genetically already have a 90% chance of having low stomach acid, which is the first step in digestion? And there's many. Okay. So if 90% of you coming in already have that, and then Christina mentioned the vitamin B12 and the iron, both of those require really high levels of stomach acid or adequate levels of stomach acid to even absorb. So Christina, you weren't even absorbing, even if you spent $1 million on the Primo Super supplements, if you weren't taking proper digestive enzymes to really absorb them, you're still shit out of luck because you weren't absorbing it. And Dana's case, she's sitting here doing a FODMAPs diet, really limited elimination diet that already really decreased the amount of diversity in her diet and phytonutrients in it. And then she discovered during the program, what digestive issue did you have?
I mean, so many, but for me, it was low stomach acid, but also lacking elastase.
Right. So that's a pancreatic enzyme. So God, how important was this? Because here's the thing. Dana could do all the FODMAP diet she wants, but without the understanding of that digestive issue and starting to take Digested and learning about this herself, there was no solution in that. She was only going to get sicker and sicker because she couldn't even absorb the food that she was eating. That was already really vitamin deficient. Now, on Christina's side of this, she also had gastroparesis and was losing weight, which means that the bowels didn't move very well. Now, if you don't digest your food in the first place, right, and you got these food that's undigested, full of allergens as well, we didn't even talk about food mapping next. How is this? Your body's fighting a war with that food. How are you supposed to move that food or even absorb anything from it? It's like a rock sitting in your stomach. These are underlying causes.
And yet their doctors aren't bringing this up at all.
There is zero training on digestion within the conventional doctor world and even the functional world. I can tell you right now, many of you seeing functional doctors or naturopaths, are they telling you digestion is the holy grail in your autoimmunity or your POTS? No, I'm the only one. I know that. But this is why POTS can be very easily solvable when you actually take the time to educate people about this. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you to see if we are indeed a good fit to work together. Thank you.